creature of the government, let me tell you. The argument is, are we going to get a recession? I say we're already in a recession. Some people are already in a depression. But all recessions and all depressions are only the correction from the malinvestment and the too much debt that has been accumulated by this monetary system that we have. And therefore, a lot of people do make innocent mistakes, and a lot of businessmen make mistakes because they get false information about interest rates. Capital is supposed to come from savings, but we save nothing. When the businessman wants something, the Federal Reserve comes in and just gives it to them, you know, on a platter, and this is the distortion, encourages business people to overbuild, too many condominiums, too many houses, and all of a sudden then there has to be a correction. So it is a dilemma, but there's no doubt in my mind that the business cycle can be explained. It can be explained by Austrian economics, and that is that it is caused by the Federal Reserve that comes in and manipulates the interest rate as well as the money supply. But how we get out of this, it's not easy because it's politically very difficult. Because the best thing in the world you can do when the correction comes, when the market says you have to have corrections, you have to have less of what we're doing, that nobody wants to take hands off. In the old days, in 1921, we had a depression that lasted 1 year and it was over. But in 1929, the depression started, and everybody thought we had to do so much, and the depression lasted until the end of World War II because of the mischief. So it's terrible to have to keep hands off. But you need to do that in order for the correction to come and for us to get back to work again. But the longer they prolong the agony of the correction, it will just last longer and longer. Markets do work. What we need to do is get the government out of the way a lot sooner. Medical care has been a major item in the campaign trail, and rightfully so, because the government's been involved in medical care essentially since 1965, and more so in the early 70s when then the tax laws were passed and mandated HMOs and PPOs, and that's when the drug companies became more influential in medical care. And now there's a medical industrial complex that runs the show. Corporations are involved. They make a lot of money, and they have come between the doctor and the patient. And this is all government manufactured, and we can correct that by just getting the government out of the way and allow you to get all your money back from taxes that you spend on it. That's right. Comes from managed care is that they manage it. That is the problem. And then they tell you which doctor you can see and who you have to see first to go to the next one, which medications you can buy. And then if you want to go into holistic medicine or preventative medicine, alternative care, then the government tells you you can't do it because they don't want to pay for it. If you're in charge and you have the money, you get to pick. And that's what you need. By the drug companies and others that believe that you shouldn't even have the right to buy vitamins and nutritional products without getting a prescription. And not only does the FDA want to get the control of some of this government, the WTO wants to be in control worldwide to write these regulations. And this is exactly opposite of what freedom is all about. Sure, when you have total freedom, you might make a mistake, but if you make a mistake, you make it for yourselves. When the politicians make a mistake, they make it for all of us, and we can't correct the problems, and that's why we have to correct. The Medicare problem, you know, when I talk to people, they say, I can't afford it, and that is true. But it also reflects back to this issue of inflation. When governments create inflation, all prices don't go up evenly. If they all did, if your salaries went up evenly and all the prices went up evenly, it would be no big deal. But it doesn't work that way. Like I said, some get wealthy over this, other prices go up, some prices, in spite of the inflation, some prices actually go down, like on the, cell phones and computers and televisions have actually not risen in price. But when it comes to medicine and education, these prices go up much faster. So the inflationary factor is there as well. But we need to change our tax code, but we need to get the government out of the way. The situation we have today means that everybody gets charged the maximum. Before, everybody used to be charged the minimum, because you didn't have, right now, today, somebody comes in and they're not on any program, they get immediately signed up for Medicaid. And then the hospitals, because they're under the gun for inflation, they're hardly making, they have to charge the maximum too. So it's exactly opposite of the way the free market works. And tragically, the noise that I hear, not so much from our side, but partially so, as well on the other side, is what we need now is national health care. That's the last thing we need, is socialized medicine.